Hi, I am Dr. Gaurav Jain. I am a consultant in internal medicine and I handle endocrinology as well. Today we are talking about understanding joint problem. What I feel is that a lot of people think that all joint problems are the same. They are not different from let's say an osteoarthritis, a rheumatoid arthritis, a gouty arthritis. While you might have heard of all these terms, you don't understand what we are talking about. So I am here to basically clarify what are joint pains and what basically is my branch, that is rheumatology. Rheumatology is the study of joints and the area surrounding it. That can include the cartilage, the ligaments, the tendons, and how to manage them. So what we do find is that a lot of people will come to us with joint pains, or they'll go to an orthopedician and they'll be prescribed a calcium or a vitamin D or maybe a little bit of joint lubricant, and they do not improve, or they improve temporarily and they then worsen up again because their workup has not been done. Your joint can be affected by a number of things. It can be uric acid, it can be autoantibodies in your system, it can be something known as rheumatoid arthritis. You might have heard of those terms. There is something called reactive arthritis, wherein a joint infection can be causing the problem, or a reaction towards certain antibodies in the body can be causing a problem. It can be a genetic disease, it can be an autoimmune disease, and all these things have to be treated, identified, and then managed specifically. And that is what rheumatology does for you. So not all joint diseases are the same, and not all joint problems are the same. So good way to go about this is basically understanding how your joint behaves. An inflamed joint versus a degenerative joint are different. A joint which has inflammation tends to improve after motion. So if your joint pains improve if you're after walking or after working out, and worsen up after you lie down on the bed, you are probably looking at an inflammatory arthritis, which is not osteoarthritis. If in the morning you wake up with stiff joints, if in the morning you have other problems like oral ulcers, congestion, eye dryness, nasal congestion, nail changes, they are all indicators that you are not dealing with a regular old school joint problem which is caused by aging and degeneration of the joint. You are probably looking at something else that needs to be looked into, identified, and treated correctly. Treated correctly being the key word here, because once you are able to identify it, there are numerous treatment options that are now available, and the cost of those treatment options is also affordable now. You can prevent joint replacements, you can prevent joint degenerations, you can prevent deformities of your joints if treated on time, if treated properly. So I urge you all to actually understand your joint disease, contact your physician or contact us to understand what's happening with your joints, and if there's any problem, come to us. Thank you.